Spencer Animal Hospital is a clinic that was opened in 1995 in the town of Spencer. Originally, it was a house, and the clinic was converted into a small clinic that would be able to care for clients and their pets in any way that they needed. It's ran by one doctor, Dr. Sullivan. It's a general practice or a small animal clinic that the patients are mostly canines and felines, but Dr. Sullivan also does see some avian patients because she has a bird herself, so clients feel more comfortable with bringing their birds to her. She also offers surgeries like spays and neuters, dentistries, but she also does cruciate repairs and mass removals. And they also offer laser therapy, and if the surgery is too big for her to accomplish, she will refer them to Colonial or Cornell. The entire house is used for the clinic. The upstairs is mostly used for the reception, lab area, surgical suite, treatment and exam room, and we also have cages for animals to recover from surgery. And the basement is used for radiology, dentistries, and grooming. The first picture on the left is the reception area, and this is what you see when you come in through the front door. There's chairs and magazines for you while you wait for your appointment, as well as a reception desk, and medical files are there for the receptionists of the day to go and get it. The middle picture on the left is all the supplements that we can carry for our clients. So there's ear solution, flea and tick prevention, heartworm prevention, collars, harnesses, Feel Away, Adaptil, and VetriScience supplements. In the middle picture on the right side is an overview of our lab area. So we have a refrigerator to keep our FIV tests, Parvo, Giardia tests, as well as our 4DX. And on the last picture on the right side is a closer up image of the lab side of it. So we have the microscope that we use for the fecals, urinalysis, ear cytologies, as well as we have machines that run CBCs, T4s, and PVCs. On the picture on the left is the surgical suite where we perform all of our surgeries except dentals. So we do spays, neuters, cruciate repairs, mask removals, and much, much more. And the middle picture is also where we keep the animals who are waiting for surgery or recovering from surgery. And animals also spend the night for spays, so we can also keep them here overnight. And the last picture on the right is just a different angle of the room. So we do have an exam table in this room where we can do sedation and clip the surgical site as well as insert endotracheal tube, and then we bring them over to the surgical suite. In this picture, I thought it was really unique that Spencer Animal Hospital did not have a separate room for exams and treatment. So most clinics in my area don't usually have this. They usually have 2 separate rooms. But I've discovered that the owners that go to Spencer Animal Hospital really like to be able to see what's being done to their pet. So we always ask if the owners are needle shy or don't like the sight of blood. prior to us following through any procedures like vaccines or drawing blood. And if the owner does not want to see the procedures being done, we can easily move the pet into the surgical suite or the recovery room where we could quickly do what we have to do. And if not, then we do it in the room with the client present. Dr. Roxanne Sullivan graduated from the University of Illinois back in 1998. When she graduated in veterinary school, she started working in a variety of clinics back in Illinois, and then when she moved here, she worked at numerous different clinics as a floater vet and filled in where clinics needed her. And when she realized that she wanted to open her own clinic, she started looking for locations, and she found Spencer, New York. Unfortunately, Spencer did not have a vet at the time, and the closest vet was in Ithaca, Waverly, or Candor, which meant the clients would have to drive at least 15 to 20 miles to get to the nearest vet, and that's pretty far if there's an emergency or if the owner didn't have transportation to get that far. So in 1995, Dr. Sullivan opened her own clinic in Spencer and has been there ever since. She runs a one-doctor practice. She has one licensed vet tech and 4 vet assistants that helps her run her practice. While at Spencer Animal Hospital, Dr. Sullivan had me doing numerous things like fecal tests, ear cytologies, dispensing medications, med math, lab work, and restraining, as well as she challenged me and allowed me to attempt my first dental, radiology, and she was more than willing to allow me to scrub in the surgeries and assist her. She even let me put in sutures during the cruciate surgery. Morgan is a graduate from SUNY Delhi. She graduated in December of 2017, and she became a licensed LVT on July 16, 2018. We were very excited for her. Morgan did her preceptorship at Spencer Animal Hospital as well as I, and when she graduated, she returned to work full-time at the clinic, and she has been working as a tech assistant until recently when she passed her VTNE. Morgan's job at the Spencer Animal Hospital is to give vaccines, dentals, draw blood, run lab work, fecals, dispense medication, and much more. She's also a receptionist. She answers questions that clients might have. And while my time there, Morgan showed me how to run CBCs and numerous different tests, because at Briar Patch everything was sent out to a lab, where at Spencer Animal Hospital we did everything in-house as much as we could. And Morgan showed me all the different ways to do that. She showed me how to place endotracheal tubes, give pre-anesthetic medication, as well as laser therapy and prepping the patient for surgery. Penny has been a vet assistant at Spencer Animal Hospital for the past 17 years. Penny is like the unofficial office manager. She's the one who makes sure everything runs smoothly and the clients are happy with their experiences. She also works and runs the front desk on Tuesdays and Saturdays when she works, but she also restrains during exams, wraps surgical packs, and helps monitor anesthesia. Penny will also run fecals. She'll get the fecals started. She'll have them spin down for us to look at. She can also set up 4DX tests for us and then waits for Dr. Sullivan, Morgan, or while I was there for me to read the results. While at my time at Spencer Animal Hospital, Penny showed me how to wrap surgical packs, take phone calls, and schedule appointments. Netta is also a vet assistant who has been working at Spencer Animal Clinic for 10 years now. She is actually Penny's daughter. At the clinic, Netta does numerous things from grooming to restraining, working the front desk, scheduling appointments, dispensing medications, and she also helps monitor anesthesia during surgery. While at Spencer Animal Hospital, Netta taught me how to calm down upset clients, as well as she helped me learn how the clinic ran and how things were done, and their procedures or protocols, and how their clinic was ran. Pat is a veterinary assistant who has been working at Spencer Animal Hospital for the past 7 years. Pat mostly helps with the front desk, but she also helps with the appointments by restraining for Dr. Sullivan. She also monitors anesthesia and helps monitor patients who are recovering from surgery. While I was at Spencer Animal Hospital, Pat always gave me the confidence while I was attempting new techniques. She also showed me how to monitor patients while they were recovering from surgery, as well as what to watch for, like their breathing, and making sure that they were warm enough. Last but not least, Belinda. Belinda is a vet assistant who has been working at Spencer Animal Hospital for the past 9 years. And not only is she a vet assistant, but she is also a groomer. So when she has extra time throughout the day, she has clients who comes in for her to groom their dogs for them. At the clinic, Belinda helps run lab work, wrap surgical packs, dispense medication, and she also cleans the kennels and monitors anesthesia. Belinda showed me how to operate the autoclave as well as the ultrasonic cleaner. Also, while I was at Spencer Animal Hospital, Belinda showed me how to file the patient records, since Spencer Animal Hospital is only half digital and the other is still on paper. Last but not least, I can't forget about the clinic critters, or the better yet, the welcome committee. So we have Moogie, who's an African gray parrot, and she's actually Dr. Sullivan's pet parrot, and she comes back and forth to work with her. So she likes to chirp and whistle at people when they come in. Then we have Kishka, who was actually a kitten who was abandoned because he had a prolapsed rectum. So Dr. Sullivan performed surgery and now he's all better, and he's an avid hunter and he loves to steal the show whenever somebody's at the front door or the front desk. Einstein, now he's the special kitty of the clinic. He was actually a feral cat who had a bad reaction to a sedative and he died. And they performed CPR on him, and luckily they revived him, but unfortunately he was deprived of oxygen for too long, and he is now blind, and he actually had to relearn how to basically be a cat. So it's actually quite impressive to watch him get around the clinic, and he loves to be picked up and he loves being loved. And we also have who we call Mr. Possum. He was brought in to us by a client who found him in their back lawn, and upon radiographs that I took with Morgan, we noticed that he possibly may have had a broken back when he was younger, and he had some nerve damage in his back legs, or so Dr. Sullivan believes. So he's not able to climb like a normal possum. So Dr. Sullivan is on the task of trying to find him a home at a nature center where he may be used for education purposes.